Hello, and welcome to the online training module, Siblings in Foster Care, Assessment Considerations for Child Welfare Professionals. This training is a collaborative effort between the University of Minnesota School of Social Work and the Center for Advanced Studies in Child Welfare. This module is part of an online training effort that covers a wide range of topics in child welfare. In this module, I'm going to talk with you about siblings in foster care, including current research findings in this area. Welcome to the online training series. There are three primary learning objectives for this module. These include a review of research regarding the influence of sibling relationships on child and family development, the impact of sibling relationships on the stability of foster care placements, permanency, and well-being, as well as assessment considerations for child welfare professionals. In Module 1, we will review the research on the influence of sibling relationships on child and family development. Siblings are a fixture of family life. These are among the longest and most enduring family relationships, typically forming in early childhood and continuing through adulthood into old age. Because siblings spend so much time together during childhood, these relationships provide an important context for developmental opportunities. Through ongoing interactions in the household, siblings influence children's mental health, behavior, and their social relationships. The quality of sibling relationships are particularly important. Sibling relationships characterized by support and warmth have been shown to promote mental health, reduce feelings of depression and loneliness, improve self-esteem and self-image, and promote socialization with peers and adults. Positive sibling relationships also help moderate the impact of stressful life events. Conversely, negative sibling relationships can negatively influence children's mental health, behavior, and their social relationships. Sibling relationships characterized by coercion, unhealthy competition, and high levels of conflict can lead to problematic behaviors in the home and community. Negative sibling relationships can lead to peer difficulties and antisocial behavior, mental health problems such as depression, and increase children's risk of substance use and criminal behavior. Siblings can be defined a number of different ways. Biological sibling relationships include full siblings who share the same mother and father. Half-siblings include children who share one biological parent. Siblings can also be defined legally. This includes a relationship formed through adoption or entry into a family system following remarriage, where children in the same home share no biological connection, but are otherwise connected through parental union. Youth in foster care, particularly in long-term placements, may form relationships which youth consider other children in the home to be their siblings. These foster sibling relationships may or may not include sibling relationships from other categories. In these instances, youth assign an emotional value to the relationship while no legal protections exist. Youth perceive other children in these homes to be their siblings. In addition to foster care arrangements, youth may be connected informally to other youth through community and extended family networks. In both foster and kith arrangements, youth assign a value to the relationships they share with other children that is characteristic of a typical sibling relationship. The process through which siblings influence the mental health, behavior, and socialization of children is informed by an understanding of social learning theory and theories of social-emotional learning. Siblings spend the majority of their daily lives together, celebrate family milestones, transitions, and traditions. Ongoing daily interactions provide a consistent framework for contextualizing siblings' influence. This is achieved through ongoing communication, the sharing of emotions, and observing behavior. Siblings teach and learn from one another through observations as well as positive and negative reinforcement. A number of factors contribute to the strength of sibling influence on children's social, emotional, and behavioral development. The size of the sibling group will influence the frequency, quality, and consistency of interactions among sibling group members. The age of children in the sibling group and the developmental stage of children in the home will also influence the quality and content of interactions among siblings. An example of differences based on the age and the developmental stage would include a sibling group of twins. In this example, the sibling group would share developmental milestones based on their shared age. Conversely, siblings separated by many years will not share the same developmental milestones. An example might include a younger sibling born 15 years after their older sibling. In this example, the older sibling will be further along in their development, and their experiences with their younger sibling would look very different. The birth order of siblings will also shape children's experiences. For example, parents may employ one particular strategy of parenting with their firstborn child, but through trial and error may adjust their parenting philosophy and strategy for later born children. The gender composition of sibling groups has also been shown to shape interactions among sibling groups. Prior research suggests that the gender composition of the group, particularly the older sibling, will shape the nature of sibling interactions, the degree of warmth, support, conflict, and competition among members of the sibling group. For children who live separately from their siblings, the frequency of contact will impact the opportunity to share experiences and foster the sibling relationship. Differential parental treatment can also impact sibling relationships. Unequal treatment of siblings can influence both the quality of sibling relationships and interactions, but also influence social competence, feelings of self-worth, as well as internalizing and externalizing behaviors. Exposure to maltreatment, either directed from the parent to the child or from sibling to sibling, can influence the nature and quality of sibling relationships and their subsequent influence on a child's development. Finally, the removal from the family system and placement into foster care will impact the potential for siblings to share life experiences. Through ongoing interactions through childhood, siblings shape children's development in a number of ways. The quality of sibling relationships can influence children's cognitive development and learning, their ability to socialize with parents, friends, and peers, as well as influence their mental and behavioral health. Children who experience unhealthy or coercive relationships with their siblings may be more likely to engage in externalizing behaviors, including bullying, substance use, early onset of sexual behavior, and delinquency. For our first reflection activity, take a few moments to think about what you've learned about the ways in which siblings influence child development. How have sibling relationships influenced your immediate and extended family system? If you are an only child, how has the absence of siblings shaped your development? Consider how sibling relationships have influenced your clients' lives. How have you witnessed sibling relationships, both in your family of origin as well as in the families you work with, changed over time? In Module 2, we will focus specifically on the impact of siblings in foster care. In particular, we will give our attention to the impact of sibling relationships on the stability of foster care placements, permanency, and well-being as it is understood in child welfare practice. It is difficult to estimate the true prevalence of siblings in foster care. States and the federal government do not systematically collect sibling data, and the identification of sibling groups is complicated by the biological, legal, cultural, and relational ways in which siblings can be defined. Further, legal definitions of siblings vary from state to state, and casework practice does not always mandate the assessment of families beyond the household into extended family networks. Best estimates of the prevalence of siblings in foster care suggest that 65 to 85% of youth in foster care have siblings who may or may not themselves be in foster care. Whether or not siblings are placed into the same foster home is influenced by a number of practical factors. First is the availability of foster homes to accommodate sibling groups. Larger sibling groups, particularly with more than 3 children, can be difficult to place and can result in sibling separation. Entering into care at the same time increases the likelihood of sibling co-placement, and children who enter into kinship care are more likely to remain together than children who are placed into non-relative homes. Siblings who are close in age and of the same gender are more likely to experience co-placement than children who are not the same age or do not share the same gender. 2 primary pieces of federal legislation have shifted the ways in which child welfare agencies respond to the needs of sibling groups when foster care intervention is required. The Fostering Connections to Success and Increasing Adoptions Act of 2008 prioritizes the co-placement of siblings whenever possible and consistent with the safety and well-being of the children in the sibling group. The Preventing Sex Trafficking and Strengthening Families Act of 2014 clarifies the adult sibling as a viable placement option when caseworkers are considering a fit and willing relative for a kinship foster care placement. Recently, states have begun adopting what is called a Sibling Bill of Rights. This recognizes the importance of sibling relationships and provides guidance to local child welfare systems to preserve and strengthen the sibling relationship. These Bill of Rights can include requirements for assuring siblings are co-placed whenever possible, providing programming specifically designed to enhance the sibling relationship, and ensuring frequent and ongoing visitation when sibling groups are separated. A number of recent studies have highlighted the protective effects of sibling co-placement on the stability of foster care. Siblings who are co-placed in the same foster home are more likely to adjust and integrate into the home setting, particularly if they live with their siblings through their entire stay in care. Co-placement is protective in both relative and non-relative homes. However, co-placement in kinship care seems to be most protective against the potential for unwanted placement change. The protective effects of sibling co-placement also appear for children who reunify with their siblings at later stages of their foster care stay. Youth who live with their siblings for only a portion of their stay in care are still less likely to experience placement change than are children who are separated from their siblings the entire length of time they are in foster care. Sibling co-placement also appears to benefit youth on their journey towards permanency. Co-placed siblings are more likely to be reunified with their parents following foster care placement than are sibling groups that are partially intact, meaning one or more member of the sibling group is separated, or situations where siblings are completely separated. Children who experience foster care separation are less likely to achieve permanency through adoption or guardianship. This is true both for siblings who experience separation through the entire course of their foster care stay, as well as children who initially experience co-placement but later experience sibling separation. Research suggests children who experience separation from their siblings experience profound feelings of grief and loss. In these instances, the emotional toll of separation from parents is compounded by separation from siblings. Co-placing siblings in foster care can help buffer against the effects of foster care intervention and provide a natural support system to children during a vulnerable and difficult time. Co-placed siblings are more likely to positively adjust to the experience of foster care placement, feel a sense of belonging and membership in a substitute family system, and feel integrated into their foster home. For this reflection activity, consider how your agency defines siblings. Does your agency have a policy that defines the sibling relationship in legal, cultural, or relational terms? How does your agency identify sibling relationships during the assessment process? Does your agency consider siblings who live outside the family home? How are your agency's decision-making processes, either for considerations related to foster care placement or mental or behavioral health interventions, influenced by siblings? What might your agency do differently to promote and strengthen sibling relationships for youth in care? In Module 3, we will discuss specific assessment considerations with siblings in foster care. There are a number of potential considerations for caseworkers and supervisors when assessing sibling groups. First, work to identify all members of the sibling family subsystem, even those who don't live in the home. Ask parents and children who their siblings are. Clarify whether there are siblings who live outside the home, such as an adult, half, or adopted siblings. Inquire as to whether there are other members of the family who they consider to be a sibling to capture non-legal definitions of sibling relationships that may have a symbolic or cultural significance. Talk directly to the youth to gain their perspective. Gather information from collateral sources such as other members of the family system, teachers, and community members to gain a well-rounded understanding of the family. In some instances, caregivers may not want to disclose the full extent of family relationships. If this is the case, explore the meaning and reasoning behind this. There may be potential resources in the community that could help in case planning or placement efforts when foster care intervention is required. It is also important to assess the quality of relationship and frequency of contact among members of the sibling group. Again, it is important to gather information from multiple sources, including the children, siblings, caregivers, and other important individuals in the family's life. You can ask direct questions to assess the current level of social and emotional support, the quality of sibling relationships, as well as severity of conflict and behavioral concerns. Know that some degree of conflict in sibling relationships is normal and developmentally appropriate. It is also important to know that sibling relationships will differ for large groups, so avoid asking questions that lump a child's responses into one question. After identifying each member of the sibling family subsystem, inquire about the quality of each sibling relationship individually. When assessing foster home placements, it is important to know that the responses you receive will be time dependent. Children go through a period of initial adjustment when entering a new home. After a period of time, youth will adapt to their placement and ideally will ultimately integrate into the family system for the remaining duration of their stay in care. The pace at which children adjust, adapt, and integrate into foster care placements will in part be dependent on their level of familiarity with the family system before moving into the family home. It is important to assess multiple perspectives to gain a well-rounded picture of the sibling and family system relationships. Children, siblings, and caregivers may not always report the same information, and as a worker, your task will be to make sense of the information you've received from multiple sources. Assess the relationship systematically and at multiple times to determine if the quality of sibling relationships change over time. Presently, no empirically supported assessment tools exist specifically for siblings in foster care. However, multiple measures exist to measure children's perspectives of the foster home generally and the children's relationships to their foster caregivers. The Positive Home Integration Scale is a 9-item measure that was validated with a sample of 328 siblings in foster care. This item asks youth to rate the quality of the relationships to the child's primary caregiver and their feelings of integration into the family system. Items are positively valued on a 10-point scale, with 1 being very low and 10 being very high. These questions are specific to the youth's experience in the foster home and assesses the youth's feelings of inclusion, kindness, respect, involvement in decision-making, quality of relationships to their foster parent, how well they get along with the foster parent, how well the foster parent listens and responds to their needs. In validation tests, the Positive Home Integration Scale correlated strongly with other indicators of child well-being, including behavior and mental health. In addition to assessing foster homes using this measure, you can consider modifying the questions to ask you specifically about the sibling relationship. For the final reflection activity, think about your professional role. What might you do to promote healthy sibling bonds for the children and sibling groups you work with? How might your agency help ensure siblings have the opportunity to strengthen and maintain their relationship during their stay in care? Thank you for watching this module and for considering the importance of siblings in foster care.